Hi there, my name is Dr. Katie Lee, and I am the CEO and founder of Collective Health Society. I am really excited about this new bespoke way of practicing dentistry because we know that the mouth is connected to over 57 systemic diseases. And what we know is as a country, we are not getting any healthier. And that's because we are not practicing integrated care. So I'm really excited at my center to be able to bring dentistry and medicine together to help patients achieve their best health. So, oral health affects fertility for both men and women. We know that the bacteria in the mouth affect female fertility in several different ways. One is going to be their ability to ovulate. So, having an infection with a bacteria called PG, Porphyromonas gingivalis, will impede a woman's ability to ovulate. It also impairs the ability of the embryo to implant into the uterine wall. And then we can also see with another bacteria called Fusobacterium nucleatum that this can lead to stillbirths, preterm labor, and low birth weight babies. Now, in men, the oral microbiome also affects their fertility. Specific bacteria in the mouth will reduce the sperm count. It'll change their morphology or the shape of the sperm, and also slows down the sperm's motility. So there's several ways that the mouth affects both men and women's fertility. Oral health has a direct impact on fertility in men. The first thing that it can impact is actually the ability to achieve an erection, which we know is becoming a bigger and bigger problem in America. And this is because one bacteria in particular in the mouth, PG, impedes arginine formation. Arginine is a precursor to nitric oxide, and nitric oxide is a vasodilator responsible for dilating the vessel in the penis so that men can achieve an erection. So if someone has a gum infection, chances are it could lead to erectile dysfunction if not treated. The other thing is that we know oral bacteria reduce the sperm count, they change the shape of the sperm, and also reduce their ability to swim. So if someone wants to have robust fertility, they should definitely go see their dentist. So there are a couple different connections between oral health and sleep quality. The first is going to be, or the main one's going to be, our ability to breathe through our nose. So most people actually breathe through their mouth when they're sleeping. This is not good because our nose is meant to filter bacteria and filter the air. And so if we're not breathing through our nose, we're essentially breathing in dirty air. When we breathe in dirty air, this is going to cause a lot of oral inflammation, which will lead to chronic systemic inflammation. It also causes our mouth to become acidic and changes the bacterial microbiome in our mouth that can lead to cavities and gum disease. The other thing that we see in a lot of patients is they actually have sleep disorder breathing, mostly from sleep apnea. And so patients who suffer from sleep apnea oftentimes will grind their teeth. So if someone has a night guard or if they have TMJ issues, that can be a sign of sleep apnea. We also see a lot of bad breath or halitosis, acid reflux, and then anyone who's on 2 or more blood pressure medications, or if someone has diabetes, they definitely should see their dentist and get a sleep test. So improving your oral health has a direct impact on your digestion in a couple different ways. So the main way is going to be there's about a 45 to 50% overlap between the oral microbiome and the gut microbiome. And if you think about it, the mouth is just the first stop on the digestive tract. And so if you want to have a healthy gut and therefore healthy digestion, you must make sure that the bacteria in your mouth are healthy because that's what's feeding your gut and making your gut healthy. The other thing is we need to make sure that you have adequate teeth to be able to chew your food properly. Digestion starts in the mouth by releasing enzymes that break down our food. And if we're unable to chew our food for any reason, we swallow bigger and bigger chunks of food, which is very hard on our digestive system. So we need to improve the oral microbiome to make sure our gut is healthy. We need to make sure that we are chewing our food appropriately. So what we know is that inflammation in the mouth is not just isolated to the mouth. It actually can cause inflammation in the rest of the body. And this is by 2 different ways. One is inflammation in itself is not really an isolated event. Unless you have kind of like an acute burn on your hand from touching a hot stove, or maybe you injured your gums, that will cause acute inflammation that will remain localized. But most of the time, the inflammation we see is because we have microbiome dysbiosis, which means the bacterial balance in our mouth is not healthy. And so when we start to see inflammation in the mouth, that will cause our gum tissue to break down. And then those bacteria will travel throughout the body and cause inflammation elsewhere. Patients with complex health conditions need to know that their mouth could be directly impacting or causing their systemic chronic condition. So if someone is unable to get the condition under control, or if they're still suffering from chronic symptoms, they absolutely should come see a biological dentist. That way we can do some salivary microbiome testing and get their mouth in better shape. And a lot of times their symptoms will completely resolve or become more manageable. So IV therapy is something that is critical to someone's overall health and wellness journey. Most of us are depleted in some sort of vitamin, nutrient, or mineral, and IV therapy delivers those nutrients directly into our bloodstream and allows for maximum absorption. The other thing that we use IV therapy for in my clinic is for detoxification. So our environment is a highly toxic place, and a lot of patients also have mercury amalgam fillings in their mouth, which are leaching mercury into the body. So anytime that we are removing these toxic fillings, we always want to detox our patients. That way it's not going to be stored up in their body and could cause issues down the road. So we want to make sure that everything that we offer at Collective Health Society is affordable to everyone. Oftentimes, dental insurance doesn't cover these types of services. So what we've done at our clinic to make it affordable and accessible to everyone is we have in-office membership plans that patients can sign up for. This includes membership plans for dental care, for medical care, nutrition care, and IV therapy. We also do payment arrangements or payment plans for patients that are as little as 0% interest that can be spread out over a year, just to ensure that we're making these services affordable for everyone. We would love to see you at the Collective Health Society. Please go to our website, www.collectivehealthsociety.com. You can book an appointment with me or any of my providers directly on the website, or you can give us a call at 303-223-2343.